Hello learners, welcome to the module on the lymphatic drainage of the lower limb. The learning objectives for the module will be listed in the next slide. The learning objectives for the session have been listed on this slide. First one, name the lymph node group located in the region of the lower limb. Give the area of drainage of these lymph nodes. And the last one would be give the applied importance of the lymphatic drainage of the lower limb. Most of the lymph from the lower limb drains into inguinal group of lymph nodes. These nodes are located in the upper part of the medial side of the thigh, below the inguinal ligament. This particular drainage can be either directly or partly indirectly through other nodes, which are called as popliteal and anterior tibial nodes. Classification of the lymphatic drainage of the lower limb. The two main components are lymph nodes and lymphatics. The lymph nodes have been classified into superficial nodes and deep nodes, whereas lymphatics can be again classified as superficial and deep group of lymphatics. The deep lymph nodes include deep inguinal lymph nodes, popliteal lymph nodes, and also anterior tibial lymph nodes, which will be discussed in detail later. Now let's go to the superficial inguinal lymph nodes. The superficial group of inguinal lymph nodes mainly drain the skin and fascia of the lower limb, the perineum, and the trunk below the level of the umbilicus. Where are they located? At the upper part of the thigh, below the inguinal ligament. Classifying the superficial inguinal lymph nodes, they can be broadly divided into upper horizontal group and lower vertical group. The upper horizontal group are further classified as the ones present on the lateral side and the ones present on the medial side, which can be seen here in relationship to the inguinal ligament. Now let's go to the horizontal group of lymph nodes. The horizontal group of lymph nodes, the upper lateral ones, include 2 to 3 nodes. They are located below the lateral part of the inguinal ligament. The area of drainage includes skin and fascia of the lateral part of the infraumbilical part of the anterior abdominal wall, the region of the buttock, the flank, and the back below the umbilical plane. The upper medial group again contains the same 2 to 3 inguinal lymph nodes. They are located below the medial end of the inguinal ligament. Their area of drainage also includes abdominal wall below the level of the umbilicus, the perineum including the external genitalia, anal canal below the pectinate line, the vagina below the hymen, the penile urethra, and the superolateral angle of the uterus. The vertical group of inguinal lymph nodes. They are located in the terminal part of the great saphenous vein, which has been shown as a blue line. They contain 4 to 5 nodes. Their area of drainage includes the great saphenous vein territory, that is on the medial side of the foot and the medial side of the leg. The efferents from the superficial group of inguinal lymph nodes that was discussed in the previous slides, they will all terminate in the deep inguinal lymph node. A few may pass directly to the external iliac nodes. Let's go to the deep inguinal lymph nodes. The deep inguinal lymph nodes are again 4 to 5 in number. They are located medial to the upper part of the femoral vein, which has been shown as a blue line in this image provided. The most proximal node of this group is called as the gland of Cloquet or Rosenmuller, which is located in the femoral canal. The deep inguinal lymph nodes receive afferents from superficial inguinal lymph nodes. They also receive afferents from popliteal nodes. the glans penis or clitoris, the deep lymphatics accompanying the femoral vessels. Efferents from the deep inguinal lymph nodes pass to the external iliac nodes. The popliteal lymph nodes. They are located in the popliteal fossa, near the termination of small saphenous vein. These popliteal nodes receive afferents from the territory of small saphenous vein, that is on the lateral part of the foot and the leg. They also receive afferents from the deep parts of the leg. Vessels which accompany the anterior and posterior tibial vessels are basically draining into this. Even the knee joint happens to drain into this particular node only. Efferents from the popliteal lymph nodes terminate in deep inguinal lymph nodes. Anterior tibial lymph node. It is an inconsistent node present along the anterior tibial vessels, which has been shown as a single node in the picture in the anterior part of the leg. When present, it collects lymph from the anterior compartment of leg. Efferents from this particular node go to the popliteal nodes. Let's go to the lymphatics. The lymphatics of the lower limb have been classified into superficial and deep group of vessels. Superficial vessels run in the superficial fascia and ultimately form two streams called as the main stream and then the accessory stream. The main stream follows the great saphenous vein and ends in the lower vertical group of superficial inguinal lymph nodes. The accessory stream follows the small saphenous vein and ends in the popliteal nodes. The green line shown on the medial side of the foot, the leg and the thigh actually represents the main stream, and the green line shown on the lateral side of the foot and leg draining into the popliteal nodes show the accessory stream. The deep lymphatics drain all the structures lying deep to the deep fascia. They run along the principal blood vessels. They terminate into deep inguinal nodes, either directly or through popliteal nodes. The applied anatomy of the subject that you have just learned can be seen with the topic on elephantiasis. This is an applied component. This occurs due to lymphatic obstruction caused by the parasite filaria. If you just look at the image, here you see that there is great hypertrophy of the skin and subcutaneous tissue seen in this particular picture. Inguinal lymphadenopathy. Enlargement of inguinal lymph nodes is called inguinal lymphadenopathy. It is the commonest cause of a swelling in the inguinal area. The cause for this can be either an infection or cancer. I hope this module has simplified the lymphatic drainage of lower limb for you. Thank you.